Hughes.
All right.
Good morning. Mr. Chairman, thank you for allowing me to speak on behalf of the Georgia Medical Board and members of the committee. The board had a special conference yesterday to review this bill.
Tell us who you are.
LaShawn Hughes, the Executive Director of Georgia Medical Board.
Okay.
And we support, the Medical Board does support this bill as written.
Okay. Any questions? Representative Jervis.
Thank you, Mr. Chairman. Ms. Hughes, we heard from a representative from the board last week and asked some questions, but I understand that there might have been some confusion, so I wanted to ask you just to clarify in my mind so I could understand.
Right.
Do you believe that that the cosmetic laser procedures are medical procedures? Is that the opinion of the board?
That's the opinion of the board, yes.
That any laser procedure is a medical procedure?
Yes.
Do you believe, or does the board believe that looking at these types of bills that we should redefine or begin to redefine medical practice with regards to cosmetic laser surgery?
Yes. We've attempted to pass rules on this before. And what we've heard from the community and from the dermatologists, other physicians who've seen patients after leaving maybe a medical spa that does not have a physician present, that they've received damage to their skin because they're not certain what they're doing, and they've been using these devices without the medical training that they needed. So the law would allow the board to have some strength into their law and to be able to regulate these facilities.
That brings up a very interesting point. If a facility is using one of these medical devices and performing a medical procedure, are they informed that they're acting illegally?
Yes, when we find out about them, we send them out a cease and desist letter. It says that you're practicing medicine in the state of Georgia, please stop. And generally what happens, it's a business and they don't go away without a fight. And generally we get a response back from an attorney to say, show us in the law where it says that using a laser device is illegal. And this will allow us to have that language to strengthen the law, to be able to push back to say, here it is in the law.
Okay. Was there an attorney general's opinion concerning this in the past?
Not for lasers. No.
Not for lasers.
No.
Okay. All right. I misunderstood that. All right. So my final question, Mr. Chairman, if, in your opinion and in the board's opinion that oversees the licensure practice for the state of Georgia, passing Senate Bill 498 as passed by the Senate will enhance patient safety, and it will define and clarify the issue of who practices medicine and who does not practice medicine in the state of Georgia.
Yes.
Thank you very much.
Representative Thomas.
Well, thank you for coming and giving your time. And I asked, to follow on his Representative Jurgis's line, Section 2, it says that the supervisor shall supervise the performance. So does that mean the doctor, as you go on further, so they just have to be on site? So, we were testifying on one that it is a procedure, but it's not necessarily, is it necessarily done by a doctor when he's under this particular language?
I think I would have to defer to an actual physician for that, to be clear. If Dr. Rachel could come up. Dr. Rachel has helped the board try to develop regulations for this through rules before, and has been at all the public hearings that we've worked on. And if you would allow, Mr. Chairman, he would probably be better suited to answer that question for me.
That's fine. It says performed by a person other than a consultant physician, which is, I'm just wrestling which, does the physician do it or under this bill or not?
physician would delegate the authority to do it. The physician would see the way I understand the bill. The physician would delegate the authority.
The bill is, in essence, requires a dermatologist, a physician who's trained laser modalities to look at this and say it's okay to use the laser procedure. But most of these procedures are performed by people who are actually licensed and described in this bill under supervision from medical doctors. You know, for instance, that's a very common medical practice, but the doctor would first determine that it's safe to do the laser procedure. And importantly, one thing I didn't mention, and Dr. Rachel not going to testify, there are many things that lasers are used to treat that laser is actually not the best way to resolve the issue. So a medical doctor could look at it and say, well, you really don't need this done. I've got a better procedure or a better device to fix the problem that you have, which is what we entrust our physicians to do, use the best medical judgment, use the best procedure to solve the medical problem.
Thank you.
Any further questions? Okay, thank you very much.
Mr. Chairman.
Okay, we have 7 people who have asked us to speak on the bill. We've got limited time. I'm not trying to cut anybody off, but I would appreciate it if you would limit your remarks to about 5 minutes, no more than 5 minutes, because you're probably going to be talking about things we've already heard about. So we'll start with Latham Hugh. Can't read your writing. Oh, okay, I'm sorry. All right, Dr. Herb Collinger.
Good morning.
Morning.
I appreciate the chance to speak to you all. Mr. Chairman and committee members, I'm Dr. Herb Collinger. I'm a general surgeon, trauma and cosmetic surgeon, practiced in the state of Georgia for 20 years. A big part of my practice involves cosmetic surgery. I'm also a medical director for Sedona Med Spa and supervise nurses who participate and do this specific laser hair removal. I think the issues are a few, and safety is kind of what I'm speaking towards. I believe that the way our nurses are trained and certified on an annual basis, which is mandatory at our med spa, and by the way, we have 3 locations. We have done 60,000 hair removal cases, so assisted by laser. So when we hear that there are different opportunities to do this procedure, I'm not quite sure what someone would be talking about, because this is specifically a laser hair removal topic that we're discussing. As far as hiding any type of lesions, melanoma that we might see, I'm not sure that the dermatologist wouldn't see these patients or clients anyway. We do not, as a matter of fact, we refer the patients on, the clients on, to dermatologists whenever there's anything there that is ominous or in question, any pigmented lesions. I train them myself. Again, the registered nurses that are providing this service are fully trained. I do that myself. I delegate to them that they are to do the specific laser hair removal under certain guidelines. Protocols are in place, and I think that we would be hard-pressed to feel that and in this case a dermatologist is actually going to perform this procedure. I think he delegates as well, and I think that by passing this bill, that the med spa business would be critically injured. We have 200 med spas in the state of Georgia. That means there's a supply and demand issue here as well, and certainly safety is utmost, but all of a sudden take away those 200 med spas that are providing this very routine type of procedure, although it is a laser hair removal procedure, cost would go up. clients wouldn't have the opportunity to have this relatively cheap hair removal procedure done. There is not another real procedure that can be done in lieu of the laser hair removal. That's why it's a simple procedure that's done, and mandatory rules, protocols are followed. At this point, we have six to eight nurses doing this procedure. Our total insurance bill for that, liability-wise, is $15,000 per year. I think we'd be hard-pressed, and as a physician, I pay $100,000 a year. So, that's dramatic. I wish you all could do something about those rates, but as far as the nurses go and the liability issues that we have in front of us, the nurses, or the spa itself, paying $15,000 a year is really a pittance, and they must know something that the rest of the committee members should know, and that is that this is a safe procedure done in the correct hands, and that is what I'm here to talk towards, and that's the safety issue, the protocols that are in place, and that a physician doesn't necessarily need to be the one providing that service as long as his or her protocols are followed. I believe I've spoken towards everything I wanted to speak towards. So if anyone has any questions, I would be happy.
We have some questions for you. Representative Shaw.
Thank you, Mr. Chairman. Going back to one thing you said, Doctor, your malpractice
Yes.
premium is $100,000.
Yes.
And MAG assured us, Medical Association assured us that when we passed tort reform, the premiums were going down. Has that happened?
Absolutely not.
Thank you.
They've continued to increase on a yearly basis, and in addition, the pay out of pocket has increased. So there's a deductible all of a sudden that we pay, even though it may go to settlement decided by the insurance company. By the way, I was involved in a case that was found for me, but without my permission, the St. Paul went ahead and settled the case for the plaintiff. The plaintiff got $250,000. Anyway, the jury found for me, but without my knowledge, the insurance company settled with the plaintiff, and that would be recorded on my record. I did not approve it. Anyway, I won't go into it any further, but I was pretty upset.
Representative Jurgensen.
Thank you, Mr. Chairman. You said that you performed, or the company's performed approximately 60,000
Right, in 4.5 years.
in 4.5 years.
Yes.
Were those individuals seen by a physician before this procedure was done?
No, they were not. Some of them were, but
How many
I can't
were-
say all of them.
How many were referred to a physician out of those 60,000, would you estimate?
Subsequent to being treated or seen by my staff, probably 5 to 10%.
So,
With
6,000.
concerns about relative to skin lesions or the client themselves asking about something, and then we referring them on.
So if it was the middle, 7,500 individuals maybe.
Probably that's a little high. I would say more towards the 6,000
6,000?
range. Yeah.
Were those who referred those 6,000?
That would
Was
be
it the
referred right
nurses?
by the practitioner themselves, or if there was a question, they would come to me, call me, and then I would make the recommendation.
The nurse practitioner?
Yes.
Are they licensed to make determinations for melanoma skin cancers?
They are licensed as a healthcare professional, and they have training to know what looks suspicious, and I have instituted in-services on specifically what lesions are of concern or should be of concern, color, size, whether hair is coming out of that lesion or not, the pigmented tone of it, if there's ulceration.
But their formal training is not for the determination of whether a lesion
I
is
can't speak
melanoma or
towards
not.
nursing training, but this is a BSN that they have, so they have guidelines. They have gone through anatomy courses, but specifically, I can't tell you that.
Any further questions? Thank you very much, Doctor.
Certainly. Thank you very much.
Alex Corner.
Good morning, Mr. Chairman. My name's Alex Corner. I own Sedona Med Spa. We've been in business for 4.5 years. I employ 20 people. I have a staff of 10 nurses. We've done over 60,000 treatments, and we have a base of about 10,000 clients. To pass this bill, it would put an additional cost and overhead on me as a small business owner that would go to each client. It would increase the prices of our services. I would have to release some of my personnel in order to facilitate the additional overhead. And the fact that we have been in business for 4.5 years and have had no major concerns with adverse reactions to any one of our clients, and as Dr. Collinger maintained, that if the insurance companies are charging us only $15,000 for liability insurance, surely, and this is industry-wide, they would know something that, about this, that there is very little liability in doing these laser hair removal procedures. And I just want to re-emphasize with you all that the 200-plus med spas in the state of Georgia are run by very small business people, and that is the backbone of our industry, or of our economy here in the state of Georgia. So you would be putting out a lot of people, out on the streets at a time when our economy can not afford any more stress. Also, I wanted to ask about the medical board. Last year, the medical board, I didn't understand how the medical board came about their decision this time around, because last year when this bill came up with regard to physicians on site 24/7, they were behind the bill that came up and was passed. And then here today, I understand we're now asking to have a physician on site 24/7. So I don't know. I don't know where that came up, and how the medical board came to that conclusion after we had already gone through this process last year.
You have a question, Senator? Excuse me, Representative Jurgensen.
Thank you, Mr. Chairman. I just wanted to get clarification. You said that no one in your facility in the 4.5 years has had any major complication. 0 patients?
Exactly.
Okay. Thank you.
Any other questions? Thank you very much.
Thank you.
Terry Hobbs, you're recognized.
Thank you, Mr. Chairman. Terry Hobbs, Hobbs & Associates. I was very reluctant to get up this morning, but the reason I did was House Bill 528 last year. We went through an extensive work to try and get something that everyone could live with. We worked extensively with the medical board. We made concessions to everyone involved and got a bill that we thought everyone was satisfied with. And now they come back this year, they want to go exactly 180 degrees. And the other piece that I was a little surprised at was the medical board saying that this is practice of medicine. But at the same time, the doctors are not going to use the laser in practice medicine. They're going to hand it off to someone else's training. And that's what we put in the bill last year, was the required training for all the people that would be using a laser. So that's basically all I have. Any questions?
Any questions, Mr. Hobbs?
Thank you,
sir. Mrs. Strickland?
Hello. I'm Ashley Strickland. I'm a nurse practitioner at Women's Institute for Health. And I wanted to speak about the scope of practice issue that this bill raises. I agree that laser hair removal is a medical procedure. I work in a practice that's been in place for 6 years with Dr. Colkin, a recognized laser expert. Our practice has had over 50,000 procedures in place, also without any major medical complications. While I agree that laser clinics without appropriate physician oversight should not be in practice, I do not think that nurse practitioners or physician assistants should be required to have the doctor see the patient first. This does not extend to internal medicine or family practice, and it would limit my scope of practice and the scope of practice of physician assistants. So to answer your question earlier, when we're seeing patients, I may not know that something is definitively a melanoma. I can recognize that it's not normal and should not be lasered over. So I think that mid-levels are capable of recognizing skin abnormalities, knowing what's outside their scope, and referring appropriately. This takes place in other avenues of health care, and so therefore I don't think we should discriminate against providers using laser services. So that's all.
Any questions? Ms. Hunt? Okay. Representative Tumlin.
Well, thank you for coming. We've heard 2 spas that have 60,000 procedures, and they sound like they do mainly hair removal.
Mm-hmm. That's primarily what we do.
And that's what y'all do.
Mm-hmm.
So, in the general term, cosmetic laser services, is that very, very broad? And
mm-hmm.
most of the testimony we're hearing today is dealing with hair removal.
Correct. The practice where I'm employed does a variety of laser services, from skin rejuvenation to laser hair removal and other things. We are primarily doing laser hair removal.
Thank you.
I don't see any further questions. Thank you very much. Mr. Robert Highsmith.
Thank you, Mr. Chairman. I'm Robert Highsmith with Holland & Knight here in Atlanta. We represent Ideal Image, which is a company that has 6 facilities here in Georgia. I've asked Dr. Tom Morrow to join me, who is one of the 4 medical directors that serves those 6 facilities for Ideal Image here in Georgia. Ideal Image also has facilities in other states. We actually have over 1 million procedures performed, over 1 million procedures performed since 2001 without any injury that caused any sort of permanent injury, and nothing of any consequence. We've talked about insurance and claims and that sort of thing. I think it's telling that the largest settlement that Ideal Image has ever paid has been $16,000, which, as those of you who lived through the tort reform fight know, is a nuisance number. I'm going to let Dr. Morrow talk a little bit about the medical supervision that he provides to the facilities at Ideal Image, and the protocols that he develops and the supervision that he provides to the advanced practice nurses and to the physician assistants who actually do the procedures at Ideal Image facilities. And with that, I'll introduce Dr. Morrow.
Dr. Morrow.
First of all, I'm a board-certified family physician and finished medical school back in 1977. After that, after residency, I actually trained physicians as well as medical students, and the setting of that was in the United States Air Force. What was fascinating is that during that time I had a considerable amount of exposure to medical techs who were straight out of high school, and within 6 or 8 weeks of good training, they were dealing with battlefield injuries, many of which couldn't be treated by most of the physicians that we graduated from our courses. So taking proper training and putting it into the context of specific focused use will oftentimes result in incredibly good overall care. Whenever we medicalize a procedure such as laser hair removal, we're going to decrease access. And almost any parent of a young child, and I've got 2 grandkids and 2 on the way, the parents recognize when that child has a lesion. All you have to do is look at your skin. We don't treat over lesions. Lesions are then referred to either their primary care physician for a review or to a dermatologist. And it's easy to know when a lesion's present. It may not be easy to tell what that lesion is. And so the need for training on how to diagnose something is a heck of a lot different than the need for training on how to recognize that it shouldn't be there. So our nurses, we have nurse practitioners and physician's assistants, are trained in laser hair removal. That's all we do. We don't use the lasers for other cosmetic purposes. In the state of Georgia, we've just the two clinics that I oversee, we've done tens of thousands of procedures, and nationally over 1 million, is what was said earlier. In the last 4.5 years since I've been overseeing these centers, two of them in Atlanta, I've seen no permanent problems, and I see all incident reports. We do have some people who end up with some sunburn type issues. If they've been out in the sun too much and had some pigment changes because of the sunlight, they'll get a little red from the laser. It's a flash of light, and it's a flash of light similar to intensity to the sunlight. They'll occasionally get some white spots from depigmentation, but they all disappear within a few weeks. Most of the what we call an adverse event or some sort of an incident report disappear within days, and literally it's just like being out in the sun for perhaps 15 or 20 minutes too long early in the spring, and like I had this past weekend, and a few days later it's gone. So we're trying to medicalize a procedure that's incredibly safe, that has virtually no major problems associated with it when done by properly trained individuals. And the people that we're treating, they don't like the way they look. These are not people that you would consider attractive in most cases. These are folks with significant facial hair, women with facial hair because of various medications they've been on, or problems with hormonal issues. There's no other way to get rid of that hair besides using laser. And the laser works incredibly well. My daughter happened to have it before she got married because she didn't want to shave. And my other daughter started getting it, but she lives so far away she can't get back periodically for it, and she's always pregnant. And we don't treat pregnant people, but she's giving me my third grandchild this summer. So in any event, I'm not sure what else you'd like to hear about, but I would really ask that you don't try to medicalize a procedure that's so safe and so effective and benefits so many people.
I think we got a couple of questions for you. Representative Bearden.
Doctor, thanks for being here. Just quick questions for you. The trained people that use the lasers, they work under your protocol, correct?
Their Ideal Image protocol. It's a national company that has probably, I've heard that they are the largest purchaser of laser hair removal lasers in the country. So they have national protocols that are used for all the training.